Hello, I'm Dr. Tanya. Thank you so much for joining. We are in such a health crisis globally, and we have reached a situation where we have to think about so many aspects of not just the health, but also economy. How are we going to live our future and everything? So, I would like to welcome you for the chat, and I'm really looking forward to understand from your perspective what's happening and what is your viewpoint on the current situation. So, can I request you to have an opening statement of what your feel is, and then we'll go through the questions.
Well, I think we have one of the biggest crises since the Great Depression of 1929 and the Spanish flu. And my opening statement is, in a crisis of this magnitude, we have to be clear on the outcomes that we want to achieve. We've got to have clarity on the key relationships needed to deliver those outcomes. And we need to make sure that as we are managing this crisis, we have the right structures in place, we've good feedback loops to know how we're going, and we have got continuously good capability to manage it.
Yep. So there has been some fantastic move from Australian government in handling this unprecedented situation. But now that our numbers are down, and especially in Queensland, we are flattening the curve. It's an amazing achievement. So I'm wondering, some of the restrictions that was previously put in place has been eased off. For instance, Gold Coast beaches, two of the beaches have been open. Some of the beaches in New South Wales have been open. So what do you see? Is this the right thing? Are we doing the right thing, or is it too early? What is your view as the national chair of AIBC?
Well, can I say that I broadly agree with Prime Minister Morrison, and it's good to see that he has a cabinet consisting of the state premiers and the chief ministers. So there's an attempt there to create collaborative management throughout Australia. And I think his three broad areas are really quite reasonable ways to assess whether it's the right or the wrong time. And the first one is the broader testing regime. And I think that we have to be satisfied that that testing regime is working satisfactorily before we suddenly lift all the restrictions. I think that's very important. The second one, which gets a bit harder, is better contact testing or tracing. Contact tracing is much more difficult. You can have apps and a whole range of things to look at it, but it would require a lot of effective surveillance and at the same time respect for civil liberties. And the third one is we need to be confident in containing further outbreaks, that is a second or third wave of the coronavirus. So the answer to your question really lies on how well we're progressing in relation to those three broad areas that the Prime Minister has pointed out to. I would add a second very important point to that, and that is there has to be a more effective relationship with the private sector so that the economy is able to resuscitate itself much faster as it synchronizes with the governments of Australia at state, federal and local level.
Yeah, you're quite right there. There's two sides of the crisis here. One is the economy, and the other stuff is the other areas, the health situation that we are in. So we have heard some of the economists, and they have strongly spoken against opening or easing of the restriction before the complete crisis is resolved. Is there a valid point in that, or is it just an observation or just an opinion? Is there a point? What do you think?
Well, economists very rarely all agree with each other for a start. So let's get that in perspective. You only have to look at our economists for the last 100 years and you'll see they're very divergent views. In the Great Depression of 1929, we had the fight between, want of a better word, the economists who thought in scarcity and the economists who thought in abundance. That is spending your way out of the Great Depression. So to seek a consensus among economists, in my view, is relatively naive. I think we have to take the Prime Minister's three-pronged criteria, but we also have to look at bringing in key partners from the industry and from the community more actively involved. At the moment, the management of this crisis is essentially driven by governments at the federal, state, local level, and is essentially driven by the health industry. Not a bad thing, but the Australian economy is multifaceted. Health is just one facet of it. From education to technology to exports and minerals, a whole range of areas of the economy need to be involved. And all of the criteria, from social distancing to restrictions at travel, affect all sectors of the economy. I welcome the initiative that the senior CEO from the private sector is working with the governments to actually inject some private sector involvement in the management of the coronavirus throughout Australian states and territories. I think now that's even more urgent, that we get the private sector, the chambers of commerce, the community groups, the voluntary groups, the not-for-profit groups. We involve them much more heavily as we move ahead, get them to own what broader testing regime means for them, get them to own what contact testing is, tracing is, and get them to understand the seriousness of what a second and third wave of the coronavirus is likely to bring.
That's right. And I think that is a very good suggestion, that now it's the time that the communities and the multicultural organizations and the Chamber of Commerce and everyone act together, because the most important thing is to pass the message. That is the most important thing.
And can I just say, on that community side, as you move into a fairly strict police regime of self-isolation, social distancing and the like, you also bring with it social problems and prejudices. Yeah. It is of concern to me that people, for example, of Chinese origin are getting racially ostracized in some parts of our country. That is totally unacceptable.
Correct.
And we should be and that's why I said involving the community, involving industry and economic sectors. We are one nation that is multicultural. It'll always be multicultural.
Yes.
It's very unfair to target a particular ethnic group that are Australians and target them as being the purveyors of the coronavirus.
You're absolutely right, and that's very sensitive. And do you think when we start to reset our economy or get back into moving forward, would this impact our employment? Of course, we all know that unemployment has surged very high. So from different cultural background or being of Chinese origin, would that kind of impact getting back onto employment? Would there be kind of any discrimination? Would you foresee that?
I think, yes, I think I do. I do foresee issues happening there as employment gets over 20%, and there's a struggle for jobs. I think you will find these issues will come to the fore. Our strengths and weaknesses as a nation will come to the fore. Our prejudices will come to the fore. And it needs to have very good leadership at all levels, on the ground, from local government, state government, national government, community groups, to say that we are one community, one nation, as we grapple with this serious unemployment issue. And it's very easy for particular individuals to scapegoat either ethnic groups or other groups for the cause of this. And we need to guard against that. Instead, we need to focus on creating jobs, resuscitating the industry, be it in hospitality, in the hotel industry, the travel industry. We need to resuscitate that tourism, and we need to do it in a smart way. And as we lift restrictions, it is unlikely to be a blanket lifting of all restrictions. It's likely to be staged, I would imagine.
Yeah.
And if it's staged, we also need to be mindful of the people that we have a social obligation to, and that is the elderly, the sick, those who live at home, and those that are socially disadvantaged or are suffering from mental illness. And of course, Indigenous Australia, particularly in the remote communities of our nation.
That's right. Do you think the message is getting wide and far, and it's reaching those communities? Because you have quite a number of roles that you hold. So in your experience with the Indigenous community, do you think the message is getting to them really clearly?
I think it's happening slowly. And I think the awareness of the impact of it and its devastating effect on a regional community. For example, I have spent 18 years associated with the Lockhart River community. And I can tell you, with a remote community of about 750 people or more, if there was one coronavirus in that community, its impact spreading would be devastating. And I think, they are moving to restrict entry, which is good, to those that only have to essentially be in those communities. And we need to really support the Indigenous communities, particularly those in remote areas of Australia, and understand that they're in a very different context from us. And the government should really bend over backwards to make sure that they're able to work through this crisis in a way that their health, safety, and well-being is paramount.
Yeah, absolutely. We touched on some situation where there could be discrimination and things like that. I was thinking about that, and that leads to my final question, or discussion that I wanted to bring to you today, was about the new app. It's much discussed, our government's new app, contact tracing. It helps in a lot of aspects. What is your take on that app? Have you downloaded that? I first of all should have asked you that.
I haven't. I've been studying it. I think there are two issues here with the app. I think the app is a very good initiative, but it should be voluntary.
Yeah.
We are a democratic country, and we respect civil liberties and privacy. Now, we're not in a country like China, where an app would be made compulsory and I can track your movements for everywhere you go. Now, this is really a matter of personal choice. So the onus on the governments, state, federal, and local, in selling the app is to sell its positive attributes so that people will say, look, I think this is a good idea, I'll download the app and use it. But if the app is abused, as a tracking device, for example, then it brings in a negative connotation. So we've got to sell it in a very positive way. No different from saying you have to have vaccinations. As you know, there's a significant portion of the population in Queensland refuses to be vaccinated.
Yeah.
They have a view about it. Now, and the government and the health department has reacted to make sure that everyone does get vaccinated, as indeed they should, be it for smallpox or whatever other serious diseases are around.
Yeah, that's true. So it should be more like a choice given to people, rather than an enforcement that they got to.
Yes, absolutely. It should be a matter of choice. Now, if you sell the message well, you'll find a very high take-up of it. If you don't sell the message well, then you won't get a high take-up of it. So the government has also got to be vigilant about who is likely to abuse this app.
Yep.
And as soon as one case is found, they should be effectively disciplined very, very quickly.
Yeah, fantastic. Thank you very much. I find this chat was very useful at different levels, and I'm glad that you could spend this time with me. And
the only point I'd make on the India side of my national chair hat is that this is actually a good opportunity for Australia and India to look at increasing their trade and investment. The coronavirus actually brings in opportunities for India and Australia to work through the supply chain in a range of different industries. And I'd strongly encourage that.
Yeah, I hope it opens for a new innovative approach, and India is full of lot of new technologies, startups, innovations, even at different levels, health sector, so many different kiosks happening. And I'm hoping that at some point there'll be a wave or a trend of India being Australia's strong business partner as well.
Look, I'm sure there is, and Tanya, you are leading that path as the chair of the AIBC Health Chapter, and your innovation is already making its impact in both the state of Kerala and in Australia. So well done.
Thank you very much. Thank you for your time.
Thank you.